If someone is in crisis right now, their primary option is go to the emergency room. And in the emergency room, we assess whether they need to be hospitalized or not. If they're not hospitalized, we give them a list of resources and say good luck. Many communities actually have a crisis center that's an alternative to the emergency room. So people who are feeling like they are in a crisis, but it doesn't rise to the level that they need an inpatient stay, they could go to that location, they could get the services they need, they could get connected with other services. We lack an assertive community treatment team or ACT team. ACT teams take care of seriously mentally ill who tend to be in the hospital a lot or tend to be in crisis a lot. We are challenged with a lack of permanent supportive housing. So if you take someone with serious mental illness, you can get them in a house to stay or in an apartment to stay, but if they don't have wraparound services to address their mental illness, then they're not going to be successful.
The gap is parents understanding what's available to them and knowing when and where to reach out to individuals to get the support. So a youth may be experiencing a mental health issue, but it's not until their parent is actively seeking that help and support and knowing when to seek that help and support. In Springfield, we do have the core co-responder team, but if we did have funding to be able to have a co-responder embedded with county, it would bring mental health out to individuals more rapidly.
One of the biggest challenges we see is meeting their basic needs on a daily basis. That affects them academically, it affects their social emotional learning, it affects their family, just across the board. Mental health then it is a struggle for them. Finances and being able to provide for the family, that also kind of ties into mental health, and just transportation in general to get students to where they need to be for appointments and things like that.